Hello, this is Dr. Turker Özyiğit. I'm from Istanbul. I've been performing reconstructive surgery more than 20 years, and today I want to talk about scar treatment. There are a lot of causes for scars. A couple of examples. After surgery, after orthopedical surgeries, after aesthetical surgeries, radiodermatitis after radiotherapies, burn scars also. So there are a lot of scars. The etiology is different, so the treatment modalities are so different. Here, the clinic of mine in Istanbul is fully equipped with lasers and invested with a wide spectrum of lasers here. I want to give you some examples about the treatment modalities. First, I have all the options for surgical techniques. I want to mention some about it. I can use local flaps, distant flaps, skin grafts, fat grafts also. And so, as it is known, the laser treatments are done on the maturated scars. So some lasers are used to cure the acute phase of the burn inflammation. Some others the late. In between the modalities, we can do some injections as bleomycin injections or steroid injections sometimes. And there are some other newly identified treatment options also, which are called like exosome treatments, cell culture treatments, plasma treatments. So these are all combined with the other modalities. So as being a plastic surgeon, I have the advantage to apply both the surgical and non-surgical treatment modalities. There is an important point of this treatment which takes time. The patients should be patient about the treatment. The laser and the other treatments are staged treatments. The intervals between the treatments take a couple of months, so the patient should need to come to me for a couple of times. Here I am in my clinic waiting to see the patients all around the world, and I will try to do my best and using all the latest modalities and the technologies to my patients.